Good afternoon, everybody. This is your friend Dr. Samir. I'm going to talk today on a very common problem that we see in our practice, and that's benign enlargement of prostate. When there is a benign enlargement of prostate gland which puts pressure on the urethra and blocks the flow of urine, in medical terms, it is called benign prostatic hyperplasia or BPH. The enlargement of prostate gland results in various urinary issues, including difficulty in urination, frequent urination, and a weak stream of urine. A prostate gland of more than 30 cc usually indicates benign prostatic hyperplasia. Homeopathy works wonders in PEP or BPH, and it helps manage it with non-invasive and holistic treatment. Homeopathic medicines not only put an end to any further increase in the size of prostate gland, it also manages well the symptoms. If one follows the prescribed regimen, one will see remarkable improvement in the symptoms such as frequent urination, urge to urinate, interrupted urine stream, straining to urinate, and unsatisfactory urination. Early intervention helps restore normal urine flow. It may also reduce the prostatic size and prevent any further complication that may occur late in life. Now, when we think of conventional treatment versus homeopathic treatment, the conventional treatment includes medicines like finasteride, tamsuline that helps manage the symptoms. However, the use of these medicines over a period of time may lead to side effects like dizziness, less semen, problems with ejaculation, sexual weakness, erectile dysfunction, and decreased libido. Prolonged use of these medications can make one dependent, and upon discontinuation of these medicines, the symptoms would return, even with more intensity. On the contrary, friends, we know homeopathy uses harmless, mild, toxic, and non habit forming medicines that treat BPH naturally without any side effects. One may discontinue homeopathic medicines as per the protocol after desired outcome, but only when a qualified homeopath advises one to do so. So, when we look at the top 9 homeopathic medicines for benign prostatic hyperplasia, the first remedy that comes to our mind is Sabal cerulata. It is one of the topmost medicines for BPH. It is used for treatment of BPH, and as you all know, it is sourced from fresh berries of plant Saw palmetto, and this offers a natural remedy. It is used to manage almost any symptom of enlarged prostate and is known to give clinical results in BPH cases. Symptoms like frequent desire to pass urine, especially at night, difficulty in flow of urine initially, interrupted urination, dribbling urine, slow intermittent trickle are managed very well by this medicine. Cystitis with prostatic hypertrophy is also one of the indications to use this medicine. Last but not least, subulcerulata effectively treats erectile dysfunction, inability to achieve or maintain erections firm enough for a sexual intercourse from an enlarged prostate. Second remedy that comes to my mind is Conam maculatum. The Conam maculatum, the characteristic symptoms irregular urine flow. It is a very effective medicine in case of interrupted flow of urine due to enlarged prostate. The urine starts and stops several times before completely voiding. After passing urine, burning or pricking sensation may be felt in urethra. There may be a dribbling of urine also. So when there is an interrupted flow, please think of Conam maculatum. The third commonest medicine is Lycopodium clavatum. It is especially given for frequent night urination. Lycopodium clavatum is a homeopathic medicine which is prepared from the club moss. It works wonders in case of frequent urination due to BPH. Urine initiation takes time and a lot of strain. Lycopodium is also very beneficial medicine to manage erectile dysfunction linked with prostate issues. So whenever there is a frequent urination, especially at night, with difficulty in initiating urination, think of Lycopodium. Also for erectile dysfunction associated with prostatic enlargement. The fourth medicine that comes to my mind is Baraitacam. The characteristic indication is sudden urging to urinate. This medicine effectively treats the problem of sudden urge to urinate, a common issue in BPH. Males who need this medicine often have a feeling of immediate need to urinate, and there is inability to control it. Burning sensation while urinating and dribbling after passing urine also is an important indication of Baraitacam. So whenever there is a sudden urge to urinate and the patient has to rush immediately to pass urine, think of Baraitacam. Another medicine which comes to my mind and is commonly used for BPH is Chimaphila umbellata. Now, Chimaphila umbellata, the characteristic symptoms are when there is difficulty in starting urination. When the person strains excessively to initiate the flow of urine, in extreme cases, the urine is forcefully passed by bending forwards. Urine is scanty, maybe foul smelling, scalding, burning sensation while passing urine. So whenever there is excessive straining to initiate urination, please think of Chimaphila umbellata. One more medicine which comes to my mind is Staphysagrine, which is an important characteristic symptom is incomplete emptying of the bladder. Staphysagrine is very effective remedy to manage cases of incomplete emptying of urinary bladder. There is sensation of urine trickling out in the urine tract drop by drop. The pressure felt on the bladder and an urge to pass urine more frequently. Burning sensation may be felt in the urethra during urination. Strangely, not even a single drop comes out. So when frequency of urination increases, along with difficulty in initiating urine, think of Staphysagrine. And of course, how can we forget our best medicine? And this is Thuja occidentalis for weak and forked stream of urine. Thuja occidentalis is the most effective medicine to manage symptoms of BPH associated with a weak, split, or forked stream of urine. Also associated with it is sensation of tickling after passing urine. Sharp pains accompany frequent urination. The desire to urinate may be quite sudden and urgent, difficult to control. Urine is foul smelling and becomes turbid or cloudy. So whenever there is a weak split or forked stream of urine, think of Thuja occidentalis. One more medicine, my friends, comes to my mind, and that is Clematis erecta. Again, a very important remedy for interrupted flow and dribbling after urination. Whenever the person has interrupted flow and there is a tingling sensation in the urethra lasting for some time after urination, urination is never complete. It is followed by dribbling with burning sensation at the tip of the penis. Think of Clematis. The urethra feels contracted, the urine passes drop by drop with sensation of incomplete emptying of bladder. So think of Clematis when there is an interrupted flow of urine and there is dribbling after urination. Last remedy to be thought of is Sarsaparilla officinalis for post-urination problems. When the person says that I get pain in my bladder region, in my perineum at the close of urination, when there is a difficulty once you pass the urine is scanty, may contain blood, severe pain at the end of urination. Urine may dribble while sitting, tenderness in the lower abdomen, the stream of urine is thin and weak. So the most important indication of sarsaparilla is burning sensation post urination. Possibility of a feeble urine stream with dribbling even while sitting. So we have seen how our homeopathy really helps in all the symptoms of enlarged prostate. I'll reiterate the symptoms of enlarged prostate. Number one, frequent urge to pass urine, especially at night. Urgent need to go to urinate. Strains when one begins to urinate. Weak urine stream. Dribbling after urination. Interrupted urination. Sensation of incomplete emptying of the bladder. And in case of urinary tract infection, there's pain and burning while urinating. Causes of prostatic enlargement, my friends, number one is age related. There are more than 50% chance of prostate gland enlargement between age of 50 and 60 years. Imbalance of male hormones as the age advances, men produce more testosterone, little amount of estrogen. But with the advancing age, the active testosterone in the blood declines, leaving back a relatively high estrogen level. As per scientific studies, these hormone changes may induce prostatic cell growth by promoting the activity of certain substances. As per another theory, increased levels of dry hydrotestosterone may increase the growth of prostate. Again, family history is very important. Males having a family history of BPH, maybe in father or brother, are at more risk. Obesity increases the risk of BPH. And certain medical conditions like diabetes and heart conditions also may increase BPH. Common complications of BPH are if BPH is not controlled in time with homeopathy, it can cause to urine retention. Acute urinary retention is a medical emergency. To drain urine in such cases, catheterization or even surgical intervention may be required. Second is recurrent UTI. Due to incomplete emptying of the bladder, there might be a chance of urinary tract infection. Also, chances of bladder stones because of retention of urine. And lastly, bladder or kidney damage. Now, confirmation of BPH is there's only one thing that you can do. Either you can do a digital rectal examination, you can do the diagnosis based on the clinical symptoms, and the most diagnostic symptoms is ultrasound. But don't forget to do a PSA, that is prostate specific antigen. It is a blood test used as a tool for screening prostate cancer. Now, normal PSA is below 4.0 nanogram per ml. If PSA value is above normal, then further tests are required to rule out the cause. Okay. So this is what everything I wanted to give you a bird's eye view of prostatic enlargement, the symptoms, the causes, and the homeopathic management. If you need, please take homeopathy. Homeopathy has an excellent scope in benign plus prostatic enlargement, and I'm sure most of your symptoms will be taken care of, and you can lead a very, very good, healthy life, good sleep, and a good quality of life. Thank you very much. Bye bye.